morning, everyone. I'm Marcia Connolly. I'll be coordinating this presentation. We have Devin Spivey from Health Department number 2 and Health Department number 4 doing a presentation for us today on COVID-19 and the numbers in our areas. Devin is, let's see, her latest title now is Community Health Director for those counties from Cheboygan down through Oscoda and Ogemaw counties and all the ones in between. So it looks as though she has 8 counties of responsibilities. She has her master's in public health through the University of Vermont, and her undergrad was through U of M. She is an epidemiologist, and she is 2 months in this new role through the health department, and previously had been their health educator for the abstinence program for 5 years in the Alcona area. So we're glad to welcome Devin. Thank you very much for joining us and giving us this information today.
Thanks for having me. Trying to share my screen here. So thanks for the introduction. As you said, my name is Devin Spivey. I'm the Community Health Director and Epidemiologist at District Health Department number 2 and number 4. I have only been in this role for about 3 months now, but I have been here for 5 years, and I have got extensive background in health education, community promotion, and things like that. So I'm just going to present on kind of what's been happening with COVID-19 through the health department, where we are kind of today, and then what we see going forward, some ongoing efforts, things like that. So I've kind of broken it down. We're going to go about COVID-19, COVID-19 data, COVID-19 testing, the health department's role, specifically the local health departments, where we stand today, and then going forward. I did want to just put a disclaimer out there. I am no COVID-19 expert. Things are fluid and changing every day, sometimes by the second. So I did want to start with a little quote, though, from an expert in his field, from the World Health Organization. It is the Director General, and it says, "We cannot say this loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic." So even though we're 4 or 5 months in now, things are still obviously changing, like I said, by the second, by the minute, and we're always learning new things, so that's exciting. For those of you who don't know, COVID-19 is an infectious disease caused by the recently found virus known as SARS-CoV-2 or coronavirus. Before this outbreak originated in Wuhan, China in December 2019, there is no known information about this virus. So that's where the novel coronavirus comes from, as it's new. As many of you are probably aware of the different symptoms, fatigue, fever, sore throat, difficulty breathing, dry cough, muscle and body aches. One of the newer ones that's recently been added as actually a top indicator of COVID-19 is the sensory, with the new or lost smell and taste. It's actually become more common in the younger people who are being diagnosed with COVID-19, and sometimes we're seeing this asymptomatic rate be really high, but we're not sure if it might be because some of these things are just really difficult to tell. Fever, they've had a really, we're really focusing on the fever piece. At 100.4 or higher, it was lowered at 1 point to 100.0, and then now there's actually a little more just kind of subjective, are you feeling feverish, because fever is so different for every individual. Difficulty breathing has been very common in the older population who has been diagnosed with COVID-19, and that's one of the reasons that many people have ended up in the hospital. So I wanted to give a quick timeline kind of Michigan-wise, and I apologize if that's a little bit small. I just put a few of the really hot topics. March 10th of 2020 was the first COVID case confirmed in the state of Michigan. And there were 2 cases on that day. March 13 was the closure of all K through 12 schools. I think a day or two prior to that was also when a lot of colleges started looking at closing, and several of them did close around the state. The 13th was also the day that gatherings of 250 or more were banned, and restrictions were placed on visiting residential, healthcare, and juvenile centers. March 16th, there was a closure of all bars and restaurants, dine-in gyms, coffee houses, and most public places. And then the gathering size was limited to 50. March 17th was the first COVID-19 related death, and the cases broke 100. So 7 days from our first case, we had already broken 100 and seen our first death. March 22nd, COVID-19 cases surpassed 1,000, and the death toll had risen to 9. So that's only a few days later. March 23rd, statewide stay-at-home orders were instituted and for all non-essential workers. March 28th, President Trump had approved the governor's disaster declaration. May 22nd, Governor Whitmer opened Northern Michigan for Memorial Day. So that was a big win for a lot in this area. April 20th, the Michigan Department of Health and Human Services had expanded the COVID-19 testing prioritization criteria. So this was also a big win, and I'll talk a little bit more about that when we get to the testing section. On May 7, Michigan Safe Start Plan was released, and this kind of outlined all the phases that we are now in and seeing across the state. And then the official phased reopening began around June 12th. July 5th, the state reported no new deaths from COVID-19 for the first time since March 17th. So another big win, but unfortunately the month of July and into early August has actually seen quite large surges in cases again. And then we are seeing big links to travel, which I'll talk a little bit more as well. So that was the state timeline, a little bit on our local timeline. So that's going to be what's been happening here at the Health Department for District Health Department 2 and number 4. On March 10th, we implemented internal incident command. That means that our structure for response, all of our staff were brought in and we're meeting regularly on everything COVID. March 13th, we implemented our own staff travel ban for recommendations that were happening around the area and what other organizations were considering to keep their staff safe. March 16th, we were open for only essential services. And then we created our first data dashboard on our website. March 17th, first COVID-19 related death. Nope, that should have been the state one. I apologize for that. March 25th was the first confirmed COVID-19 case in the District Health Department number 2 service area. And March 29th, so 4 days later, District Health Department number 4 had their first confirmed case in the service area. April 1st, in collaboration with the Northern Michigan Public Health Alliance, our health officer issued a public health advisory related to travel to Northern Michigan. We were seeing obviously a lot of travel with everything being shut down downstate, and we put out a health advisory letting everybody know that we could very quickly have be inundated with different cases, outbreaks that our staff would have a hard time managing in these little health departments, and then also our fragile healthcare system could obviously be inundated as well. Excuse me. On April 6th, an emergency order requiring screening and social distancing measures at all open businesses and operations was implemented by our health officer along with several other health officers across Northern Michigan. And this was meant to align with the governor's executive order 21, which looked at protecting essential workers. April 13th, there was a new executive order that came out, number 42. And so our health officer and other health officers across Northern Michigan, they had made some adjustments to their emergency order and then implemented 2020-2 emergency order. June 12th, the phase reopening begins as well in around our area, so locally. And then July 2020 to August 2020, again, like much of the state, we were seeing case increases, and they've kind of remained steady for our area. So most people are aware that COVID-19 does spread very easily. It spreads from person to person, but it also can spread from surfaces, common areas. So it's basically just aerosol droplets or droplets from your nose and mouth that land on surfaces. Other people touch them, and then if you touch your eyes, nose, or mouth, you can become infected if COVID-19 is present.
Mm-hmm.
We have been seeing relatively high numbers of asymptomatic people. So this is when people who are infected with COVID-19, they do test positive, but they had no signs of illness or they felt fine. And I'll talk a little bit more about this asymptomatic here shortly. So a little bit of the data. So we have created on District Health Department number 2 and number 4's website a data dashboard. It's updated Monday through Friday. And this kind of just gives you an idea of the cases that we're seeing. So we are updating total cases, daily probable cases, and then recovered cases. So if you were curious about how many cases remain active or under investigation, or who have not met the state's definition of recovered, which is 30 days from onset of symptoms or 30 days from testing positive, you could look at the total cases minus the deaths minus recovereds, and that would let you know how many people remain as somewhat of an active case. Okay, so basically, this is for DHD2 snapshot. It shows you how many cases by county, cases by gender, and cases by age range. The same thing for probable. And then total deaths you can see by county and by gender. And then we also look at contacts traced. This is where a lot of our nurses' efforts go towards. So it's important that we are showing these metrics. Contacts traced typically takes about 30 minutes for the initial contact and then 15 minutes for every monitoring day after, which can be up to 14 days. So again, you can see that we've traced 400 contacts to date. And this number is possibly a little bit low still, but that gives you an idea of kind of how much time our nurses have been spending on contact tracing. There's also a little bit of a graph here for new cases by date, and then an epi curve looking at cases by onset date. And then, so if you go to our website, you are able to maneuver over all of these different objects, and it will give you a little bit more information. I just took a screenshot so it doesn't show that, but if you went to the website, you would be able to hover over these specific colored areas, and it would let you know what zip code that is and then how many cases are in that zip code. And that was a feature that the public had really been asking for, and it's been met with great applaud. So we were happy to be able to offer this. Many areas you will still see have less than 5 cases listed, and that is for HIPAA purposes. In our small communities, you may be able to pick out, say the person was a 91-year-old lady and there's only one in the community. So that's the kind of stuff we deal with in these smaller communities. So we have to still be very aware of HIPAA with those kind of reporting measures. And then same thing for District Health Department number 4. So I'll leave it here for just a couple of seconds. Again, it kind of just gives you the definitions of what the confirmed is, what a probable is, what a recovered is, and what a total death is. These are state definitions, so they come from the Michigan Department of Health and Human Services, so we just follow their guidance. And then we pull all these numbers daily from the Michigan Disease Surveillance System. So again, Monday through Friday, this is updated on our website. For anybody who's not familiar, our website can be found at really easy addresses, www.dhd2.org or www.dhd4.org. And then we have different coronavirus page on each website that would take you to these data dashboards. And then again here you can see the zip codes for District Health Department number 4 area. Anything that's still left in white like this means that there aren't any cases in that area yet. They have 434 contacts traced to date in the DHD4 jurisdiction. And then you can see again the new cases by date, and then the new, or the epi curve here for cases by onset date. So about 80% of people recover from this disease without needing special treatment. That's a number that comes from the CDC currently when they're looking at all cases, recovered cases. It is actually a little bit higher at this point in time because the younger population is now becoming the most common population that is being diagnosed with COVID-19. And that population isn't seeing as high of mortality rates as the older populations were. So here's some information kind of just on source transmission that we have been seeing around the area. So as you can see here, for District Health Department number 2, long-term care, this is actually, I do apologize. This is supposed to be District Health Department number 4, and this one is District Health Department number 2. So long-term care and non-residential settings remain the most common, while general community spread continues to increase steadily. So that's here at the 25%. Again, so this goes with that. I really apologize for that. And then for District Health Department number 4, long-term care settings remain the most common at 69%, while general community spread continues to steadily increase as well, which is over here at the 19%. Some other international travel, District Health Department number 4 hasn't seen any cases related to that, whereas District Health Department number 2 has had a few. Domestic travel, again, is going to be anywhere within or out of the state of Michigan, but still in this country. In-state travel, we're looking at Michigan travel to high areas of incidence, so a lot of places in further downstate, the Detroit area and around that, Oakland, Wayne, and then it also includes over near the Traverse City area because there were some outbreaks early on over in that area. Long-term care settings, again, are going to be all of our long-term care facilities around our areas. There's several of them in northern Michigan in our 8 counties that I cover. Other healthcare settings are going to be things like hospitals, clinics, rehab facilities, different things like that, which fortunately we haven't really seen outbreaks coming out of those type of settings. Non-residential settings are workplaces, daycares, camps. And in District Health Department number 2, we did have one very large outbreak that was kind of publicized. That's what a lot of this 30% came from. We did do a mass testing. Over 1,100 employees were tested during that. So that's kind of where this piece comes from. Community spread is when we can link it back to another case somewhere. They don't live in the same household, but they were able to be epidemiologically linked back to a positive case from around their community. And then we do have a couple unknowns where people just weren't really able to provide much information. They said they didn't travel, they didn't go anywhere. So we just weren't able to link that back to anywhere. COVID-19 testing. So basically, I just wanted to show a quick timeline of how it works. So someone develops symptoms, you have high risk for exposure, so you've been deemed a close contact, you would call your primary care provider or find a testing site near you. Our website has a link to the testing site locator from the Michigan Department of Health and Human Services, or you can find that on their website. There aren't very many in our area, unfortunately, which is just something we've been following and have seen as a challenge since the beginning. You would receive your COVID-19 test on your appointment day. Typically, it's a nasal swab or nasopharyngeal swab. You patiently wait for the issuing provider to call you with your results. So whoever the provider is the one who calls and gives you your results. You would follow their instructions based on what your result is. If it is positive, you would receive a call from your local health department to follow up and start the contact tracing process. So I calculated some very approximate general positivity rates by county based off of what the testing data that is available. So these are here the different percentages you see. Alpena has a relatively high one. It's unfortunately based on the large long-term care outbreaks that we've seen early on in Alpena County. So that's why it's a lot higher. Montmorency, unfortunately, just has not seen much testing. So there is the likelihood that there is more disease present. We just haven't had much testing for it. They still are under 1,000 tests completed in the whole county. And overall, there's the potential for more disease in all of these counties. Again, testing just has been relatively limited across our region.
Devin, this is Dick Bremer. What is positivity rate? Is that the number of tests positive versus the number of tests, or what is it?
Yeah, so it's the percentage of positive tests out of total tests conducted. And so this is only going to be the confirmatory PCR type tests. This isn't going to include the antibody tests, which I will talk a little bit about. So these are just the ones that tell you that disease is present now out of the tests that have been done. Great question. So some challenges we've seen with testing in our area has been turnaround time. So the window for COVID-19 symptoms to appear is typically 2 to 14 days. Someone comes and gets tested. We are seeing, unfortunately, in many cases, a 9 to 10 day turnaround time. And so this doesn't help the local health department with our contact tracing efforts because these people could, while they're waiting for the result, be out in the community and no fault of their own, they just aren't aware. And a lot of that has to do too with many people being asymptomatic, like I previously said. So turnaround time continues to be an issue we're struggling with. Lab reporting is another issue. In the beginning, the state health department was really the main lab on board, and we were getting all negatives, positives, all tests. We knew the total numbers. And then they were so busy and so backlogged on labs and conducting them that so many other labs came on board. So it was a good thing, but also then we weren't exactly sure how many people were really being tested. Some of them were being sent out of state, and it really just kind of depended on what the facility went to and who they contracted through. So there are several dozen of labs on board now. And they have been kind of working out the bugs on reporting, but it's still a little bit messy. Retesting has also been a challenge. So this kind of has to do with the limited testing supplies and limited testing sites. So you get a first test, it comes back negative. You decide you want to get another test. That's been an issue in the area. Fortunately, insurance has been covering pretty much everything COVID test related, but again, being able to get a retest has just been a challenge for most people. And some businesses are wanting to require a retest for people to come back to work, so that has been something that we've been navigating as well at the health department and seeing how we can't help people get back in for testing. Limited testing supplies was more common in the beginning, but we are starting to hear it again. The state is conducting over 20,000 tests a day on average. according to their website. And so these testing supplies, we did end up getting quite a few that came in, but with us using that many a day, it is starting to become common again for the limited testing supplies to be an answer we're getting from the state. Limited testing sites, technically, any primary care provider could do a COVID-19 test, but it is up to them whether or not they're providing them. So a lot of our federally qualified health centers around the area, they did get quite a bit of funding at one point to implement COVID-19 testing and to hold mass testing locations. However, and they have done so. However, a lot of area does have the smaller clinics, and they just don't have the capacity to do so or the resources. Doctor's notes are being required by some areas still, which by definition, the state has opened up the prioritization and the requirements. However, it is up to the facility whether or not they're going to require the doctor note or not, and most of them in the area still are. Some sites are offering a virtual doctor visit in their parking lot to where you can get in. So that's been a nice option that some have been able to come up with, but that still remains a challenge. And then again, some places are requiring you to have symptoms to be tested. That's not supposed to be a requirement anymore, but based on maybe the site's capacity or their ability to garner the testing supplies, they are still requiring people to have symptoms at many of the sites. So serology tests are going to be the antibody tests that everybody wants because they think it can tell them maybe that they did have the disease a month ago, 3 months ago. A lot of people were saying that they had symptoms back in January, February, December of last year. But unfortunately, serology tests are not diagnostic to this point. They do not guarantee immunity, but they might provide information about previous infections. So some areas, a couple hospitals in particular, I've heard are conducting these serology tests or antibody tests. If a person does get a positive antibody test, it does get kicked back to the health department, and then we do contact people to find out maybe if they did have symptoms, when they had symptoms, looking back, into the last 3 months. And if we can pinpoint a high risk scenario where someone knew they had traveled and then they did have symptoms in a certain period of time, then we are being directed to mark those as probable cases. So that is something newer that is still kind of evolving, but some places are offering the serology test a lot more than others. In 7 of the 8 counties that I cover, less than 100 of these serology tests have been conducted, though. And there are a lot of hands in the pot when it comes to serology tests. Everybody is kind of coming out with one. There's a lot of them that you can see at home tests, different things like that. So there is a list on the CDC of FDA approved ones that were kind of approved more for emergency use, to be for emergency medical procedures. They could be done prior to that kind of thing. And then they are more rapid, so that is why some places want to utilize those. But again, they're not diagnostic at this point. So I have kind of talked a little bit about the health department's role throughout all of this, different things that we have done. But to break it down a little bit more, we basically prevent, promote, protect. Those are the big things that we look at, that we are constantly working at in our communities. So we prevent disease through prompt contact tracing. This is going to be where anybody who's positive, we contact them. We want to know who they've been around up to 48 hours prior to them testing positive or prior to them having symptoms. And it would, the state definition currently is 15 minutes with a person who is tested positive or more. So this contact tracing is very important to breaking that disease transmission chain. So we do this within 24 hours. Our goal is to contact all positives within 24 hours of being diagnosed to find out who their contacts are. We enter them into the Michigan Disease Surveillance System, and then we follow them for their 14 days of quarantine period. If they develop symptoms during that time, then they are considered a probable case because they were in contact or a close contact of a positive. And then they do get counted on our dashboard. So that's kind of what that probable case piece is. So those are all contacts, close contacts of a positive. If they don't develop symptoms over the 14 days, then they're released from quarantine and able to go back to normalcy as that is right now. We also prevent further transmission by releasing exposure locations. So if you follow the news at all, we have been releasing these a lot more often, unfortunately, but this is when our contact tracing team is not able to identify everybody who was present at a potential exposure location. So these are things like restaurants, large gatherings, grocery stores, different public places where a person was there for longer than 15 minutes, but not able to say who their close contacts were at these locations. So that is the only time that we release these, but like I said, unfortunately, we have been releasing them quite often. We promote health and well-being, obviously, through messaging about good hygiene. That's huge with COVID-19. We promote testing. We advocate for testing as well because, again, it's been very limited in our area. We promote the preventative measures that have been laid out through the state and by the CDC. So we do a lot of messaging around those type of things. We work to protect the public, obviously, public health actions. So some of those I defined, like our health officer implementing the emergency orders for the area, writing letters to the governor, those different kinds of things to get public health actions moving. We have recently had to kind of crack down on some large gatherings that have taken place. So those are all public health actions that we have the authority to take. We protect through education. So obviously education is key and one of the biggest things that the health department can do. So we're constantly, like I said, putting out messaging. We are always taking phone calls, educating about COVID-19, about things like the exposure locations that people don't understand, about contact tracing because it's a very complex system sometimes, educating about different hygiene practices. We're putting out press releases about large gatherings, about holidays, about just staying safe in general, all of that kind of stuff. And then we're always also monitoring the most vulnerable populations, making sure outbreaks aren't happening there. Again, prompt contact tracing would be huge, like our long-term care settings.
Devin, there was a chat question that came up about do contact tracing people have a unique phone number they call from, or do they leave messages if you're not there, or how does that process work?
Yeah, great question. So we definitely do leave messages if there's a voicemail, and if we don't get a voicemail and someone didn't pick up, then we will try again. So we will try for several days in a row. But yes, there is, it will come from a local health department number. We have recently employed a automatic system though through the state because we have been seeing case increases with a lot of community spread. And this system is called TraceForce. Much of the state is starting to get on board with this system as well. And state contact tracers are the ones who are calling to follow up on all of our low risk contacts. So all of our positives would still get a call from us. And then the initial contact will be made by us as well with any of their close contacts. And then anybody who's considered a low risk contact, so they're not showing any symptoms at this time, they're put into the state's database and picked up by this trace force is what it's called. And they're monitored, they get their daily calls from them. And they just ask the same types of questions. It's just finding out if you get, have any new symptoms, things like that. And then if somebody did end up showing symptoms during their quarantine period, that would be kicked back to us as well. So we monitor anybody who does have symptoms. So all those high risk contacts, anybody in the long-term care setting stays with us. But definitely we continue to call. We sometimes we do text messaging if it appears that is a textable number. But I hope that answers that question. If there's any other questions related to that, let me know.
Yes, there was a question about our people that are contacted generally cooperating with the tracing process.
Another great question. So in the beginning, we'd seen a lot more cooperation than we are seeing recently. A little bit of that just seems to be tied to that people are very much over COVID, and it's hard to blame them. Some people are a little bit weary about whether they should be answering these types of questions over the phone. So that sometimes just requires a little more education from the health department. But overall, I would say that it's been perceived pretty well.
Great. And one other question came up. Does the health department do business inspections for opening of restaurants and so forth?
So anybody who is licensed, has a food license through the local health department, we are doing our annual inspections as normal. And then we are looking for different measures as far as, are they following the executive orders and different things like that. So yes, if it is somebody that we typically license, if it's someone like a grocery store or a gas station, those are licensed through the Michigan Department of Agriculture, or MDARD. So we have been directing complaints and different things like that related to that entity.
Great, thank you.
You're welcome. So obviously messaging matters. And I just was, on this slide, I was thinking just to give a general idea of a lot of the things that we've really been harping on, and I'm sure every one of you has seen them all over the place, all over the news. There's signs everywhere. But obviously washing hands with alcohol-based sanitizer or soap and water, which soap and water is obviously the best option, but you're starting to see hand sanitizer become a lot more popular like it once was. But we do encourage the soap and water if it's available. So we've really been pushing those messages, especially for the kiddos as they're getting ready to go back to school. That can be an issue. Keeping a distance of at least 6 feet between yourself and anyone not from your household has been a big thing. Obviously, that's that social distancing or that physical distancing that has become such a hot topic this year. And you're starting to see crafty things people are doing with these like social distancing donuts that they'll put around themselves, or the carrying tape measures, and different things like that. So you'll see a lot of places have the signs on the floors and in the checkout aisles, and I'm really hoping those kind of things stay for a little while past this, because it's one of those things that you just don't realize how close you are to people sometimes unless those things are there. And then when in public, wear a mask to cover your nose and mouth. Obviously, that's become really big as well. In the beginning, we still get a lot of questions about why did they once say we didn't need to do this, and now they're saying we do. Well, we all know everything with COVID is evolving. There's new science every day. Again, it's not 100% effective. It's a cloth face covering. So it's better protection than not having anything. And there are lots of really cute videos and really scientific ones too out there that people have done these different tests where they put the mask on and they don't have the mask on, and they do a test for coughing and sneezing and talking and singing from 6 feet and 10 feet and 20 feet and different things like that. And it's just amazing to see the germs in the petri dish when you're not wearing the mask versus when you are wearing the mask. And again, they're not foolproof, but it's better protection than nothing. And obviously, like all preventative measures, they work best when everybody's participating. Covering your nose and mouth with a bent elbow or tissue when coughing. So when you're at home and you are with those people from your household, it's still good to use that measure when you're obviously not wearing your mask. And that keeps your germs and your droplets with you. Seeking medical attention if you have difficulty breathing and high fever has been something we've been pushing obviously since the beginning as well. And that's, more of those common sense ones that sometimes we don't think of when we're in those situations. So really just kind of pushing that still. And then follow the direction of your state and local health officials. So as I'm sure many of you are aware, enforcement has been a tough one. The health department is able to call and educate and really, describe the reasons for these measures and different things that have taken place, but we don't have handcuffs and we don't have badges, and we really don't want to have to do that either. I've had taken many calls lately trying to tell people that we don't want to be the fun police. We just really need people to follow the directions of the state and local health officials so that we can get past this. And I think that one really gets across to everybody. So where we stand today. So I just have this one picture for this section that really just kind of shows you, obviously, the disease is still very prevalent and spreading across the state of Michigan. We're looking at a total, and this is for yesterday, a total of 89,271 confirmed cases, total deaths 6,273, daily confirmed cases yesterday was 517. So that's still really high for a daily case count. Back in June, we were down in the 100 and 200 range. So this shows you kind of how July and August really kind of kicked back up. And then daily COVID-19 deaths was at 9 yesterday. With the death piece, it has actually been really low as well. So that's obviously always a good thing. And then, like I had mentioned before, a lot of the younger population is now is the more common population to be diagnosed with COVID-19 right now. And that's a lot of the reason that we believe you can see that correlation with the lower death count. And this is from the state of Michigan, Michigan Department of Health and Human Services website. If you go there, you're able to click on the see cumulative data, and it breaks it down even further by county if you wanted to click on one of these counties. And it shows you that this diagram specifically shows you that a lot of northern Michigan remains, at the lower end, but it travel's open. It's happening. It's summer. It's the time when everybody wants to be out, wants to be up at their summer cabins and cottages. And obviously we welcome everybody. We just hope that everybody takes precautions and listens to the state and local officials as far as orders go. So going forward, COVID-19 is now a reportable disease in Michigan. So what that means is the health department is no longer getting negative of positive cases. So this is kind of a double-edged sword thing. We don't really know how many places are testing, how many tests are happening a day. The state has their numbers, but locally we're not able to really gauge those numbers like we once were. This helps the health department so that we're not sifting through hundreds of negatives a day, because we are seeing that happen when we're seeing 20,000 tests statewide a day. But it is a reportable disease now, so that's kind of that shift that we've seen.
Devin, there was a couple questions that came up. One is there a particular statistic or favorite statistic that you prefer to follow?
Just in general, is that?
I'm guessing that. This is all from chat.
Yeah, so I mean, I guess the way I would interpret that is just a general statistic, and my favorite statistic to follow would be the recovereds. Obviously, that's the most positive statistic we can have, is seeing that those recovereds are climbing and the deaths are staying low. So that would be my favorite.
Okay, the other question was, does the health department are they involved in advising schools on their reopening plans?
Yep, and so that's going to be on one of my slides here coming up on our ongoing efforts. Good question.
Thank you.
Yeah, so antibiotics obviously do not work against coronavirus. We've been hearing that since the beginning. So the question is vaccine or serology tests. So we're going to keep looking to what the science is, what the research is coming out on these two pieces. Like I had said before, serology tests are not diagnostic at this point in time, but they very well could be as they keep being vetted through. Vaccine. The state of Michigan, Henry Ford Health System in particular, has become the first hospital in Michigan to administer a COVID-19 vaccine study. So that's kind of nice to be able to hear that these things are actually happening here on the home front versus sometimes people don't like to hear that they're happening in a different state far away from us, and what does that mean for us? So that's always nice and exciting to hear that there's research happening locally. And then again with that serology test, the Food and Drug Administration, FDA, has granted emergency use to a couple different tests. So I do think we will start seeing those become a little more common in our areas, is especially with them being a little bit more of a rapid response result on those. But we will just have to wait and see on those two things. So prevention and progress remain key. Continue masking, social distancing, hand hygiene, limiting non-essential travel and large gatherings is still important. Much of the community spread that we are seeing are people traveling out of state still here in the US, but out of state. Conducting daily health screenings of employees is very important still, that businesses are utilizing those different tools that we have sent around. And if there's anybody listening who wants new and updated tools, they're always on our website. We keep that as up to date as possible. Implementing enhanced cleaning protocols is very important with COVID-19 as well. Ensuring open operations and businesses have and use preparedness and response plans. So that was a requirement of one of the governor's executive orders, that people, operations, businesses who are open to the public have a preparedness and response plan. The health department has templates of those as well that people could utilize and just fill in for their business. And the health department could always call and ask any business that's open if they've got that handy that we could take a look at. So that's something good to have. And it's kind of just based off of OSHA common practices, things like that. School reopening. So we are very involved in school reopening right now. Everything school that's going on, we've been getting some of the plans to review. Part of the reopening roadmap for the schools that the governor submitted is that the health department work in consultation on these plans with the schools. So we are very hopeful and looking forward to getting the kiddos back to school and having as much normalcy as possible. I know a lot of schools are still looking at those virtual options. And it's nice that they are being able to offer different options for different families. But yes, we are very involved in that school reopening process right now. And then we continue to monitor the most vulnerable populations with the long-term care outbreaks in our area. We all know that they were pretty devastating to the area, so we continue to hold very close relationships with those different facilities. We have nurses who are linked to each facility and are able to provide resources and support as needed. And then the big thing is sustainable testing and getting that to our area, especially as school gets back in session. We want to have that option available should a kid need it and need a quick turnaround result on that. Anybody who's seen the news lately, it's a hot topic, the school in Georgia where one kid tested positive the first week and they're up to potentially 800 cases. So we don't want to be that school on the news. But if we were, we would definitely want to have this sustainable testing in the area. So we continue to advocate for that sustainable testing in our area and to really get more providers on board with offering that testing.
I have a question about the testing.
Yeah.
Going back to March, it's been really frustrating and really stressful not to be able to have open testing anywhere in this area. And certainly with school starting, it's going to be more of an issue. But as far as I know, there was no open testing here until June 19th when the guard came. And I don't understand why downstate there's open testing in many locations and you can get same day results, where it took me 8 days to get results. And it's my understanding it took 2 weeks for Mackinac to get their results. So why is Northern Michigan so far behind on this whole testing situation?
So a lot of it has to do, again, with the labs and whoever it's contracted through. So we did have the National Guard testing, and we were able to offer that at 4 different sites. Mackinac City was the first or Cheboygan County was the first that we offered in our area back in May. And then we did hold 2 in July, or 3 in July, 1 in Alpena, 1 in Tawas, and 1 in West Branch. But unfortunately, those were actually the sites that we're seeing that long turnaround time. And it had to do with who the state had contracted with for that testing. It was a lab out of state. And, with all of those testing sites happening around the state, they just could not keep up with the lab, all the samples that were coming in. We definitely echo your concern and frustrations related to the testing, and I can assure you that the health officer for District Health Department number 2 and number 4 is very much advocating at the state and possibly even looking at more of a national level of how can we get this testing here. She's talking with different committees at the state level to try to get people to realize that Northern Michigan is still not seeing the same testing sites and turnarounds as downstate. A lot of it then has to do with the different sites who are able to support testing, and still continue their everyday routine visits and business that they do. So we are trying to work with different sites to figure out how we can help them to get testing in. We have been able to collect some supply of testing materials and are willing to share those with different sites if they're able to start conducting testing. I would encourage everybody to keep watching that testing site locator and watching for the different sites that are available. And as they come available, we do put those on our website, and we do continue to look at mass testing sites. But obviously that's not the most sustainable option. We would like it to be that you could walk into your doctor's office and say, I have this symptom, or not even have symptoms if you're just really kind of not feeling at 100% yourself, or you have any question because you were around somebody, that you should be able to get that test. So
do you know why it took until late June to get the guard testing here?
I know that they had just started with some sites around the state just prior to that. And we were looking at the turnaround times for that. And, unfortunately, we still seen the same turnaround times that other people were. But that was one of the things we were monitoring, how that was looking and going. The guard is going to be here in Michigan until the end of December. So we are still looking at some other sites as well. But we want to make sure that people are getting quick results, because otherwise it doesn't make much sense to even get the testing if it's taking 2 weeks to get a result back.
Thank you.
You're welcome.
Devin, is there different types of tests? It seems like there's some are very fast turnaround, some are 2-week turnaround. Is that based on the laboratory situation or something?
Yeah, so there have been some rapid tests that have come out. Not many places have those available to them yet. I don't know how many places have even tried to get them either. There were some concerns in the beginning with that just being a new option on how that would look and, efficacy behind it. And there really isn't any hard statistics on the efficacy behind them that I could find. But it's just that it's more of a newer testing method, and so not many places are utilizing it yet. But I do foresee that being more readily available, hopefully when school opens back up and it's needed. Obviously,
Great.
it is right now. And then, yes, it has to do a lot with the labs too. So some places actually have in-house labs, like a couple hospitals in the area, they have their own labs. And so they can get really quick turnarounds on that. When other places have to send them, like I said, out of state or back to the state lab. And then it's kind of just waiting in the queue whenever, whenever your time is up.
Is there a published site or something on what's the false positive and false negative rating of the tests?
Not that I have seen. The CDC does monitor several of the different FDA approved options that are out there. But there really isn't much on efficacy yet. And one of the issues with looking at that in our area is the retesting that's not happening. So you can't really tell whether the person, was a false positive or a false negative or not, because they're not getting that retesting done. So that can be a challenge as well.
Thank you. We did have one other chat question that came in about, assuming a vaccine becomes available sometime in the future, does the local health department have a plan for vaccination? Some of us remember standing in the parking lot of schools getting polio vaccinations. We're wondering if we're looking at that or if there's a plan in place.
Yeah, that's a great question. At this time, we haven't really been looped into many vaccination talks. Much, as the news is putting out, they are starting to really get trials kind of happening around the area. But we very much are watching for those different correspondence to come out, and we'll definitely be getting the information out to the public as soon as we know something on that. So that is all I had. I don't know if there's any other questions, but I'm more than happy to take any questions you have. And if there's specific questions that somebody wanted to send me an email, and maybe I can send links or different things like that, if that would be helpful, please do get in touch. But other than that, that's all I have.
For all of you online, if you just push your space bar and hold it down, you can easily ask questions also.
That was a great presentation, Devin. Thank you.
Thank you.
Thank you, and lots of good
Come back
questions.
if things evolve into something else. Was there another question?
This is Dick Bremer. Thank you for displaying the data that kind of shows the sources of infection. I think that's one of the issues in my mind. It's been very fuzzy in the past what those are, and I think that helped a lot. Thank you.
Yeah, absolutely. That's one thing that we definitely really watch to see the trends, and obviously if there's more communications we can get out related to a specific source. With LTCs being or long-term cares being the most common source for a while, really the only thing we could do is work with those facilities, and they were in lockdown. So it's just unfortunate how things kind of go when and that shows how it really can spread once it gets into that type of setting. So that's why we're really working with the schools so that we don't run into something like that come school time.
This is Chuck Austin talking.
Yeah.
I just wanted to say that our kids are downstate and they can't get one-day testing, and so they can't come up and see us. I mean, it's not a panacea of testing downstate, at least not in Oakland County and the Lake Orion, Rochester area. Testing is a problem everywhere.
Absolutely. Yeah. Like I said, it really is kind of site specific, whether or not it's hit or miss, and really the site specific on, who's got the rapid and can get you a result within 24 hours, but it's really uncommon.
Devin, with the schools, Are there plans that they will do temperature checks on each arriving student?
So some schools are looking at that option. Other schools, they just don't see it being possible with staffing constraints. And that's one of those things that they're really going to have to rely on parents to do their part in you know, assessing symptoms in the morning and not sending kids back to school. I think every parent has been part of that "you're not too sick to go to school" thing when the kids fake it, but we really are hoping that that's not a trend this year.
Okay, good, thank you.
Have they talked at all about hiring school nurses again?
I have not heard that, you know, and it's interesting because our area is one of the few areas I think that does suffer from that lack of school nurses. I do hear that they have them in quite a few areas, but
Right. And we used to have them, of course, but we don't
Yeah.
anymore.
Yeah, and a lot of them, I think, you know, that's where we really got to get these partnerships with our local clinics up and running and keep them all looped in. And we have been able to bring some of those type of staff into our conversations with the schools. And everybody's been very great to work with and very open to and receptive to what we have to offer and sharing. So it's been a really interesting and eye-opening process. And there's just so much that goes into it. And you know, there's just so much uncertainty.
Any other questions? Well, thank you very much, Devin, for all of the information and your assistance today.
You're very welcome.
And again, it looks as though the contact is dhd2.org or dhd4.org for information at your offices.
Correct.
Thank you very much for your time and all the information.
Thanks for having me.